Hello, magandang hapon po. Happy Monday and thanks for joining us. I'm Dr. Ana York Bondoc and our program po is called Libreng Consulta. So you are welcome po to put your comments and questions below as we will discuss a very important topic which parati po tayo dapat gawa ng X-ray but I suspect that a lot of us don't know kung ano ba talaga and kung ano ba ang nakikita po sa isang test. So it's actually the most common medical radiologic procedure and done millions and billions of euro identity. I think that we need to know more about chest X-ray and why they do that. So my name is Dr. Anila Soto. I'm a pulmonary specialist. So how do I check my chest X-ray? I'm also an internist. I'm a former congresswoman and the mom of an 8-year-old. Nandito po ako ngayon sa San Juan, San Luis, Pampanga. Please follow us on YouTube. We are trying to reach 1,000 subscribers. And please share po kung may kilala po kayo nagpa-X-ray, may kilala po kayo magpapa-X-ray. Share nyo lang po. So put your questions down below and let's have a libreng consulta about the chest X-ray. You may also flex po yung inyong chest X-ray and I'll leave comments about it if I can. Okay? So sa inyo po, let's start. Tara na. So, first picture is, I think I have a normal chest X-ray. Ano nga ba chest X-ray? So, let's go first with the letter. Dear Doktora, I am a public school teacher. At bakit po paulit-ulit yearly ang requirement po ng aming chest X-ray? Parati naman po akong normal. So, nagtataka na po ako, bakit paulit-ulit po itong annual chest X-ray ng Department of Education and how can it protect me and my students? Okay. So, ma'am, napakaganda po ng tanong, ano? I'd like to emphasize a few points on this question. Number one, she's a teacher. Number two, it's required every year. Number three po, yung kanyang students, tinanong niya po yung safety. Okay? So, those are what I have identified. And of course, the fact that I'm glad naman po that every year it is normal. Kasi syempre, pag may abnormal chest X-ray, ang meaning po nun, may findings na po sa chest X-ray which we would need to investigate further. Okay? So, let's go with point number 1. So, the question is, letter A po, I think I sent something. Or you can project the picture din naman. So, let's wait po. X-ray, as I mentioned to you, is the most common po medical procedure. So, let's start po. Miss Kat, are you ready to project anything? Or nawawala po ba si Miss Kat? Oh no, hindi na daw siya makabalik sa StreamYard. So, let's go muna. Annual. Ba't nga ba nagkaka-chest X-ray? Okay. First point letter A. Bakit po ba nagkaka-chest X-ray? Bakit po siya annual? The answer po is tuberculosis. Okay, that is the reason po that people do chest X-rays every year. Naghahanap po sila talaga ng TB. Why are we looking for TB? Okay, bakit siya related to becoming a public school teacher? Pag it is a public safety po, and especially if you are dealing with children, large groups po, if you are a nurse, if you're a medical technologist, kami po as a resident, we were X-rayed every year. It is a requirement po talaga and much suggested because TB, just like even more pa than COVID, talaga pong nakakahawa. It is also an aerosolized disease and the first signs of TB are usually found in the chest X-ray. So, reason for annual chest X-ray, TB. Need for public school kasi po mga bata po ang kaharap nyo. Aerosols po si TB. Requirement po yan ng Department of Education. Usually po for people in high contact jobs like teachers, I mentioned, hospital, flight attendant, kailangan po yan. And as you go for every job interview, ang una po nilang hinahanap is tuberculosis. Okay? Not COVID, tuberculosis. So, may X-ray ba tayo? Nawala na naman po yung ating photos. I'm sorry, we cannot project anything. But kwentuhan na lang. Okay, second question, no? Bakit po when I entered the emergency room, parati pong chest x-ray ang hinihingi, lalo na po kung merong lagnat ang pasyente. Okay, second question. Ba't nga ba? Ba't nga ba tinatanong? What are they projecting? Hintayin lang po natin so that we can see. Can you see po? Ayan, okay. So, palakihan lang po. Ayan. Can you see the numbers? Okay. That's the chest x-ray po. That's more or less a normal chest x-ray. And may nakikita po tayong white structures at may nakikita po tayong dark spaces. Okay, structure number 1, yung sa gitna po, no? Number 1, yan po yung puso natin. Our heart is in the center po of our chest. And yun po yun, ano? Number 1 is the heart. All right. Number 2, nakikita niyo po ba si number 2? It's on the dark space. Ayan po, si number 2. Yun po yun, the dark space, yan ang air spaces. Okay, the white spaces are the solid structures. Heart po yan. The number 2 po, I think that's number 3 that you're trying to show. Number 2 po is the black air space. Yun po yung baga natin. That is the lungs. The lower portion po may number 2. Sa baba po. You can try and move it. There was a number 2. Okay. Baka hindi naman. Ayan, lumalabas na po si number 2, no? It's on the left side of the screen. If you can see me po, dito po, no? This side. Yun po yun. That's air. And what is the aerated structures po ng ating chest? That is our lungs. So, there's a right lung and a left lung. Kaya po, dalawang sides po yon at yung puso po natin ay nasa gitna. Okay, number 3 po nasa taas. What are those? Those structures, that is the rib. That's actually the clavicle. Ano? Ito pong buto po natin dito sa, here on our shoulder. I'm tapping my clavicle right now. And then yung pababa po na smaller structures, those are the ribs. And then number 4 po, that's also a white structure po sa gitna. Yun po yung ating vertebrae o yung buto nyo po sa likod. Number 4, nakikita po sa gitna pababa. Okay? There are other smaller structures po in the chest x-ray. Hindi ko na in-emphasize kasi po marami. No? You can also see the airspace po of the esophagus or kung saan po bumababa ang kinain po nating pagkain. Sa baba po ng number 1, below the heart and below the lungs, the horizontal line, yun po yung ating diaphragm or that is the muscle that separates the chest from the abdomen. Okay? Sa baba po ng number 1, that is the diaphragm and that is what separates po our chest from our abdomen. Yung ating pong dibdib sa ating pong tiyan. Okay? So, can we project letter A? Yun po yung tuberculosis. Ano? And that's the reason for the annual exam. Usually, the most common po talaga sa TB, I think I sent it to you, is the apical infiltrates. Tingnan po natin yun later on. The apex po is here, dito po sa taas. Ano? That's pinakatuktok ng chest x-ray. Diyan po talaga karaniwang nakikita po yung tuberculosis because that is the most aerated part po ng baga. No, what's the mean most aerated? Doon po talaga yung pinakamaganda air exchange sa taas po ng baga natin. And that's where TB lives because TB lives on air. And TB is long, it can stay. It's a chronic organism. It needs to feed, it needs to breathe. Dito po talaga pinakamagandang pwesto po talaga ng baga natin. Unfortunately, TB is not only located in the infiltrates. TB is a great mimic. Anong meaning nun? Kahit ano ho, sa chest x-ray nyo can actually be TB. So TB can be anything on a chest x-ray. So sa Pilipinas po, if a diabetic presents with weird findings on the chest x-ray, the first thing that we would investigate po would be tuberculosis. In the Philippines, diabetes plus weird chest x-ray is almost always TB. Lalo na po kung non-smoker po yung tao. Okay? Point B po, what I asked po was, the question is, bakit ho, pagpunta natin sa ER, lalo na kung may lagnat, chest x-ray muna, ano ba hinahanap nila? The first thing that we are looking for in a person po who went to the ER na inuubo at linalagnat is usually pneumonia. Nakikita po ang pulmonya. One of the most common things to be seen on a chest x-ray is pneumonia. It can be po bacterial pneumonia, which is the most common. Meron din naman pong COVID pneumonia or viral pneumonia na nakikita rin po. Pneumonia is one of the most common diagnoses po sa chest x-ray And again, it usually presents as infiltrates or namumuti po yung baga. We look at that later. So, fever, ubo, high white count, namumuti ang baga equals almost 90% of the time pulmonya po yung sakit, and that patient needs to be cultured para malaman po natin kung ano po yung cause of pneumonia and most likely po to be started on antibiotics. Okay? Letter C, question. May nakikita ho bang mga cancer sa chest x-ray? Yes. There are a number of cancers that can be seen on chest x-rays. Primarily lung cancer kasi po sa baga po nagmula. It can be a solitary nodule, single nodule. It can be anything din po, no? Kahit ano ho, makikita talaga. Cancer can present in many ways on a chest x-ray. Okay? Pwede rin hong clear yung chest x-ray, may lung cancer po kayo, and that may be seen po sa lymph nodes or very, very subtle, nakatago po sa loob po ng mga bronchi. So yes, cancer can be seen. Lung cancer is the most common. I think I projected breast and colon are cancers po. Breast and colon are cancers na nagmumula po outside of the lungs, pero very common po na kumalat sa loob po ng puso, sa loob po ng baga natin. So if you have breast cancer, nahihirapan po kayong huminga, you are coughing a lot, we have to investigate po if your breast cancer has spread to your lungs, and the x-ray followed by the chest CT is probably one of the first ways to do it. Colon din po, if you are known history of colon cancer, bigla pong hinihingal na po kayo, you're having chest pain, you may be having repeated pneumonias, be aware that colon cancer can easily spread to the lungs. Okay? So cancer in the lungs can be cancer from lung cancer, or it can be cancer from other parts of the body po na pumunta po sa baga natin. And makikita po natin yon sa isang chest x-ray. Question din to. Can we know a lot about the heart sa chest x-ray? Kasi di ba may heart sa chest x-ray? No. At least masasabi ko, no, the chest x-ray is a poor diagnostic tool po for the heart. Like kung inatake ka, hindi ho malalabas yun sa chest x-ray. The only thing that can really be accurately seen po sa chest x-ray regarding the heart, and again, hindi pa rin masyadong malinaw, is heart failure. Because mamumuti po, no? There will be water in the vasculature, so mamumuti po yung chest x-ray nyo. This happened to me after ako po nanganak, and then I went into heart failure. Nung in-x-ray po ako, naging puti yung baga ko, nagwala ako. Okay? So this is the only thing really that can accurately be said about the heart sa heart failure po. Ano? Heart attack, hindi po makikita yan. Enlarged heart, mahirap pong masabi though. Some people, nung unang panahon, used to say enlarged heart via chest x-ray. But later on po, the echo is the best way to see if your heart is enlarged po talaga. The echo and the EKG are better ways to find out po yung function, if you're having a heart attack, size, etc. ng inyo pong puso. So remember this, the chest x-ray is not a good way to evaluate your heart. Okay? And lastly, bones, mga buto. The white structures in your lungs, may bali ng buto, nakikita po. May bali yung clavicle, may bali po yung ribs, makikita po. Would you project po letter, tama ba? Letter E? Okay. Buto muna before the breast implant. Sorry. So, yun nga po, buto, may bali ang buto, nakikita po talaga yon. Broken ribs, broken clavicle, scoliotic spine, nakikita rin po yon sa chest x-ray. So, pinuntahan na po natin, you can check out TB, you can check out pneumonia, baga po yon. You can check out mga bali ng buto. It's not good for your heart. And lastly, very interesting din po, breast implants. I asked this question. Paano mo malalaman kung yung girlfriend mo ay may breast implants? Choice A, kapain mo. Choice B, tanungin mo. Or choice C, pa-x-ray mo. Kung gusto niyo pong malaman kung talaga pong totoo po yung inyo pong dibdib po ng inyong hinaharap, pa-x-ray nyo po, lalabas talaga po yung breast implants. And I will show you po later. But again, that's really not the best way to investigate breast implants. I think the best way to do it is to be honest. Tanungin nyo po. Kung close naman ho talaga kayo and you trust each other, why don't you ask that question? But definitely, breast implants po, lalo na po the older ones, the newer ones, medyo mahirap na hong maganda na ho yung pagkagawa eh. Nung una talaga ho, talagang very dense po yung mga breast implants. Nakikita po talaga yung pagkaputi po nila kanan at kaliwa sa chest x-ray. Now, it's a little more subtle and sometimes they can be mistaken for pneumonia. So, kung magpapa-x-ray po kayo, this is very important, this is not a joke, kung magpapa-x-ray po kayo ng pasyente who has a known history of breast implants, halimbawa inuubo na sa ER, may history po ng breast implant, you put requesting chest x-ray with a history of breast implants para po malaman po ng radiologist who's reading na yung nakikita niya pong puti po sa baba, right and left, are not the breast implants. Para malaman po niya whether breast implants yung tinitingnan niya o pulmonya ho talaga. Okay? So, sige po, I think we have a few pictures to talk about. Ayan. Please put your questions down below and I'll try my best to answer them. So, ito po yung may arrow sa taas. That is the apex, po. Yun po yung tinatawag po nating apical infiltrates ng chest x-ray na suggestive of tuberculosis. Pag meron po kayong marami hong pre-employment, may nakikitang apical infiltrates so nagpapanik lahat. Pag nangyari po yon, there's what we call po, this is taken from the back, that's called the, the PA view. Postero-anterior, the x-ray passes from the back to the front. So, kailangan po natin ng apical view. There is an apex view. Apex, yung taas po talaga ng baga, no? There is an apex view po, and you can request that to really find out if someone has TB or not. Okay, next. Ito po yung may square. Tama ba ako? Am I looking at the one with the square? Sorry, malabo po talaga yung I'm having a difficulty seeing po kung ano po yung na-project. Tingnan ko lang po. Hirap talaga ng Ay, ito yung may square. Yes. If you notice po, there is a black square. Yan po. Very subtle. May parang round po dyan na puti. Paki-enlarge lang para makita nila yung laman ng square. Yan, yan. Nakikita po may puti, Ayan, nakita na. Yan po yung tinatawag po nating solitary nodule of chest lung CA, lung cancer, no? Yan po yung solitary nodule. If you are a smoker, marami po nito walang nararamdaman. Bigla na lang kung pagpapa-x-ray, then may makikita, then mapupunta sa akin. Ano to? If you have a history po of smoking, and bigla na lang pong we know that you have a normal chest x-ray like 1 year before, si teacher nga every year, 1 year before, biglang may lumitaw na ganyan, kailangan po yung mabiopsy. High suspicion for lung cancer. Pwede ho bang TB yan? Yes. Pwede pa rin hong TB yan. It's very common sa Pilipinas. Okay, next slide po. Kung di ako nagkakamali, this is pneumonia on the right side. Kung nakita nyo po, you notice one side po yung puso, malaki. Sa kabila po, parang may puti pero hindi na puso. Yun po yung pulmonya. Those are the pulmonary infiltrates po of pneumonia. So this person po has right lower lobe pneumonia. Nasa kanan po, this opposite of me. Okay? So the heart is on the left, the pneumonia is on the right. Okay? Okay, ito po, no? Anything else? Yan po. Nakikita po yung pulmonya nasa kanan. Okay. Anything else? Ito, maganda to. This is the breast implants na sinasabi ko. Nakikita nyo po ba? Pakilaki lang yung ayan sa baba. Ayan, nakikita nyo? Okay. Doon sa tabi po ng puso, right and left, may pagkaputi. Now, if nobody told you na breast implants po yan, and you're the radiologist, and you're there in the x-ray room, malamang ho mababasa niyo yan as bilateral pneumonia. So I'm not joking around about this. This is a very serious issue. Kung meron po kayong breast implants na pasyente o kung kayo ho ang may breast implant, pag magpapa-x-ray po kayo, kailangan nyo talagang ilagay history of breast implants. Otherwise, mababasa po yan as bilateral pneumonia. Okay? So, yan na po. You can see it from further Okay? Ano po yan? Wait lang I'm gonna wait for the x-ray to, ano. Okay. 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 That's how to read a chest x-ray. Nakikita niyo po yung radiologist, no? Most of the chest x-ray nung unang panahon was read in the dark, no? Sa dark room and then there's a light behind the chest x-ray, mga plaka ho. Pero ngayon, bago na ho, they're usually projected onto a computer. The radiologist is the guy po here seated down. Tinitingnan niya po yung computer niya and andyan po yung x-ray po ng baga. Okay? So that's how they read chest x-rays na ngayon. Noong unang panahon, linalagay ho talaga on a board na may ilaw, pero ngayon iba na. Okay, this is how you shoot a chest x-ray. Sabi ko nga po, from back to front. The most common po, nakatalikod po yung tao, yung pasyente. Here, it's a kid from the machine. You can see the machine po on the right side, the child po on the left side. Nakita niyo po, no? The likod po muna. So it's called postero-anterior view. The beam will pass from the back to the front of the patient and then nandito po yung plaka sa harap. Okay? So yun po yung makikita natin. Okay, I think that's it. So sa inyo po, to all of those who are requesting a chest x-ray, this is a very short ano lang po about chest x-rays just so you can understand more about it. Number 1, hindi po masakit ang chest x-ray. Number 2, konti lang to. Of course, you're gonna get radiated, pero it's not a lot. Don't worry po about the amount of radiation that you're gonna feel from a chest x-ray. You have to remove po yung damit nyo kasi yung mga botones, yung mga underwire po ng bra, makikita. So you really have to remove po yung top nyo. But don't worry, they're gonna give you naman po a gown. Okay? Kasi po, nakakaabala po. Sometimes may safety pin, may mga necklace na hindi po natanggal. So nakakaabala po talaga yon and they need to be removed. So you'll be asked to remove your shirt unless most likely po you be asked really to remove your shirt, your blouse, including your bra, especially kung may underwire or yung mga hook ng bra lumalabas din po. Yung mga side elastics din, ay yung naghahawak po na elastic na metal dito, lumalabas din po. So that is the reason why we have to remove our clothes or at least the top, may gown naman, after the chest x-ray. Kung hindi makatayo yung pasyente, pwede ba silang ma-x-ray? Marami pong no? When I used to work in the ICU, we did all our x-rays po with the patient lying in bed. So pwede po yun, But again, if the patient can stand, it is better to bring the patient downstairs. Kasi po, we were on the 8th floor, second floor, the x-rays on the bottom floor. Better ho na kung kayang tumayo po ng pasyente, patayuin nyo. Because you will really see better kung talaga pong nakatayo yung pasyente versus doing an x-ray ng talagang, well, obviously kung hindi naman ho nakatayo and intubated patients in the ICU, they are x-rayed every day para i-check po yung kanilang ET tube, yung kanilang lines, yung kanila pong feeding tubes. So they have to be x-rayed po lying down. Okay? So that's it. A chest x-ray is very important. It is the most common diagnostic procedure radiologically na ginagawa po sa isang tao. We do millions and billions every day. I hope that this helps you understand more what we are looking for po in a chest x-ray. But again, hindi lang po x-ray It's very important to get the reason for the chest x-ray. For example, inuubo, linalagnat, wala nang panlasa. Okay, COVID na yon. But basically, we do a chest x-ray based on what we think is happening. Hindi siya ginagawa lang just to do it. Okay, there are reasons to do it and it's very important for us to know the history. So, yun lang po and very good afternoon.
From Ms. Kathy Rodriguez. Hi, Dr. Anna. Can pneumonia be diagnosed with a chest x-ray?
Yes, ma'am. It can be. And it's often diagnosed using chest x-ray alone. But again, very important din po yung history. For example, 75-year-old lady who had cough and colds 3 days ago, now with fever of 38 degrees and difficulty breathing, presented to the ER. Chest x-ray, right lower lobe infiltrates, pneumonia yon most likely.
From Mr. Raymond Alan Sese, one of our viewers on YouTube. Dr.
Ako na po magbasa. From Mr. Raymond Allen Sese, from YouTube po, Doktora. Doktora,
Doktora, 10 years ago po, father ko po died of lung cancer, late stage 4, na na-discover due to constant ubo. Question ko po, ilang beses po ba dapat pa-check ang x-ray a year para maiwasan ang late stage ma-discover?
Napakaganda ng tanong na to. And I discussed this earlier because I was interviewed by a surgeon from UP. Okay, what is the screening of lung cancer? Bakit nga ba tayo naglalang ka? Ba't tayo, ano yung, paano na, for example, eto na lang, you are a 50-pack year smoker. You are 50 years old. You've been smoking for 20 years, okay? How do you know that you have cancer or what should you do? Helpful ba yung chest x-ray? Sir Raymond, I'm sorry to tell you that the chest x-ray is not a useful screening tool po for lung cancer. Though pwede naman ho, like for example, na x-ray nga kayo yearly may nakita. Pero studies have shown that it will be late, hindi siya na-detect ng chest x-ray until very late. The point of screening is to detect the lung cancer when it is still early na meron pa hong magagawang solution, which is surgery. So if we rely on the chest x-ray, most of the time what we will detect po is late. So the screening po ng lung cancer is actually a low-dose CT scan yearly. So if a person has a long history of smoking, above 50 years old na po, ang kailangan po talaga niya is a low-dose CT scan every year. And hopefully, pag may makita po tayo, maaga pa lang siya at maoperahan po natin yung tao. Para hindi po natin ma-discover na stage 4 na. And I would like to say, majority of lung cancer po in the Philippines is discovered at stage 4. Malungkot nga yun. And I'm sorry to hear about your dad.
From Mr. Ronel Bordalio, Doktora Ana, question po. Given the circumstances, today na may pandemic, ano po yung best way para magpa-x-ray? Mahirap po kasi mag-ask ng request for x-ray today dahil may pandemic. Lalo na kapag ang ipapa-check up mo yung ubo. Normally, ang assumption agad ay COVID-19, then sa COVID ward dinadala at hindi sa OPD.
Ganun ho talaga ngayon eh. I would put cough na lang. I just put chest x-ray routine. Kung ayaw nyo makaladkad kagad sa ano. Sandali I am finding it hard to answer this question. Okay, number 1. If you are having COVID symptoms, okay, like nalagnat, inuubo, talaga nawawala na po ng panlasa, you really have to go to the COVID ward, okay? Talagang kailangan po, and you need to be ruled out. Though I understand na talagang, and this is a problem yung mga asthmatic, emphysematous, kasi agad-agad ho silang nadadala sa COVID. Kasi nga ho, the moment anyone hears cough, immediately, ting, 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 COVID ka agad. So I would understand po, no? Pero kung talagang COVID naman po yung symptoms nyo, you need to go naman ho talaga sa COVID. Pero if you're having a chest x-ray po, for example, you're a teacher, job requirement, job applicant, hindi naman, don't be afraid naman po na magpa-chest x-ray. Kung talagang iba naman ho yung pakay nyo. Kasi po, safe naman po. What I'm trying to say is may health protocol naman. You will be wearing a mask. Kasi hindi naman ho tinatakpan nung hanggang dito lang si chest x-ray, nakamask ka naman. Okay? All the people din po in the x-ray will be wearing masks. So if you're worried about COVID, like, because you're applying for a job, ganon, and annual requirement, wala ka naman nararamdaman, safe lang po magpa-x-ray sa ospital. Ngayon, kung meron ho talaga kayong nararamdaman na COVID symptoms, wala ho tayong choice, but we need to be ruled out for COVID. Mahirap ho talaga. And I have been approached by asthmatics, emphysematous, COPD, lung CA. Doktora, ano ba, may lung disease nga ako, kaya ako inuubo. But really, in this day and age, the moment you mention cough and fever, naku, rule out COVID na kaagad yun at baka ma-PCR po kayo. So very valid po yung tanong nyo. Very, very, very valid.
From Mr. Timoteo Bondoc.
Sandali lang Yung isang kakilala ko, my sister-in-law, na pa-chest x-ray lang po sa St. Luke's ER, naging 35,000. So Reyna, hindi biro ito.
Agree ako, Doc. Agree. And
hindi biro ito.
Hindi biro ang mga chest x-ray, doktora. Hindi biro.
Ang ano na lang, Kung sa tingin nyo hindi naman ho, like you're asthmatic and you're just coughing talaga and you really don't think you have COVID, there are some hospitals that will not require you to pass through the ER. Yun, mas mura yon kasi talagang direct outpatient po yan.
Next.
Okay, next.
From Mr. June M. Tudino. Good afternoon po, Doktora.
Sir June, how are you?
From Miss Maria Teresa Ngo Nazareno. Good afternoon po, Doktora Ana.
Thanks, Maria Teresa.
From Miss Elisa M. Dungo. Good afternoon po, Doktora.
Hi, Elisa. Magandang hapon.
From Miss Rosario Cataina Gionzon. Good afternoon po, Doc Ana.
Hi.
From Miss Remedios Nogoy Jeronimo. Gandang hapon po, Doktora. Ingat po kayo lagi. God bless you more.
Thanks, ma'am. Ingat din. All of us ingat. We need to.
From Mr. Ronel Bordalio. Thank you po.
Hey, thanks, Ronel. So I think that's it.
Yes,
thank you so much for joining us. And we will see you po during the week. Right now, naka-schedule na po yung, tomorrow I have a talk with the Rizal Zonta Club, so wala po tayong live. On June 30, there is a talk with Dr. Silvino Martin Corpus on dialysis, myths, and facts. Ano, Reyna? We are celebrating po, June is National Kidney Month. So we are celebrating po National Kidney Month or pinagdidiriwang po natin ang health po, no? Kalusugan po ng ating bato or kidney with a kidney lecture on dialysis myths and facts. So yung mga nagda-dialysis, yung mga natatakot pong magpa-dialysis, Dr. Dondo Corpus is my classmate. Dr. Corpus is actually from San Luis, Pampanga. Tiga rito po siya. He comes from Kabayanan po ng San Luis and he has graciously agreed to guest para po sagutin yung mga dialysis myths and facts. Diba, Rina? Ang daming tanong about dialysis all the time.
Doc, very controversial yan ngayon.
Lalo na, I hate to say this, nakikiramay din naman po tayo. Our former president was undergoing dialysis when he passed away.
Yes.
So,
Actually,
marami din kong nagtatanong.
Yes, I've been reading a lot sa mga news ngayon because syempre after a week or a day na mag-pass na yung controversy, no, diyan na maglalabasan ng mga haka-haka ng mga tao. Magandang mapag-usapan.
Yeah, it's we scheduled this before all events that happened. And indeed, yes. June is National Kidney Month. So,
but we have already talked about this last year, diba, Doc? We have several topics regarding
na rin ho kami I've done number of talks on kidney. Yung isa was dialysis in the new normal kay Dr. Benjamin Balmores. Dr. Benjamin Balmores is the former chief of St. Luke's Global and St. Luke's QC Nephrology po. And then I also did a kidney talk on diabetic kidney. So, problema din po talaga yon. And now, ang pag-uusapan po natin is dialysis myths and facts. Ang ganda. So, I think we have a last comment or bate. Meron
yes,
ba?
Yes, Rowena S. Viray. Good afternoon po, Dr. Ana. Ingat kayo palagi. God bless from Makabebe po.
Wow, thanks, Ma'am. And to everyone, thanks for greeting us. Thanks for joining us. Maraming salamat po.